Okay, hello. I'm the surgical assessor, Dr. Aman, working for Mr. Mann at John Hopkins Hospital. I'm calling to speak. I'm calling to speak to the vascular consultant to ask an advice of an uh, critically ischemic patient for the fear of losing her limb. Can I check that am I speaking to Mrs. Smith?
Yes,
Okay,
summarize your case.
okay, ma'am. Mr. Istiak, age 45 years old, which, came with serious abdominal pain. The symptoms is now improving with intravenous antibiotics and fluids. And suddenly she complains that her right lower limb is going to be paler pulse, and on checking of the pulse on 11 p.m. I didn't find any pulse in her distal limbs, and she also complains that her pain is not responding to paracetamol.
Hmm.
Uh, her
Okay.
blood samples reveals hypokalemia, and ABG shows metabolic acidosis, and ECG shows absence of the pulse and premature ventricular complex, and arterial duplex suggests that acute ischemia.
Okay. So, what do you think that um, do you need a cardiologist to review for PVC before transfer?
No, I think that can be assessed later on.
And can you send the patient tomorrow morning?
Sorry, ma'am.
Can you send the patient tomorrow morning?
Uh, No, it's urgent because the patient is critical limb ischemic, and so I think he needs early intervention, uh, as she's extremely needed for the fear of losing the limb.
Okay. What do you think the presumed diagnosis of diverticulitis?
Uh, she has abdominal pain, and uh, now in the view of acute limb ischemia and atrial fibrillations. I have to consider that she might have mesenteric ischemia as cause of this patient abdominal pain.
What are your differential diagnosis?
My differential diagnosis is maybe appendicitis, cholecystitis, pancreatitis, or irritable bowel syndrome, and mesenteric ischemia, or perforated viscous.
Okay. Do you want to scan the abdomen first?
We'll need to scan his abdomen, but I think that he can do it after the transfer.
Okay. Could it be mesenteric ischemia?
Yes, it may be mesenteric ischemia, but now the abdomen is non-tender. Abdomen is non-tender and abdomen is soft. So I'll do serial abdominal examination, and if we need that, we'll do the CT scan of the abdomen. If the renal function is normal,
What imaging will you do?
duplex study and CT angiography.
What anticoagulate will you do? Will you use?
Low molecular weight heparin, also unfractionated heparin, bolus, and 5,000 international unit.
Which one do you prefer?
I would prefer unfractionated heparin
Why?
because it needs surgery and it is easy to reverse and
Because we can reverse it by protamine sulfate and একটা হচ্ছে we can monitor it by
monitor
APTT.
it, easy to monitor. Yes, ma'am.
Hmm, okay. What is our target APTT?
Uh, 40 to 60 seconds, ma'am.
Okay. Okay, what is your management plan?
At first, I'd like to correct the hypokalemia. Then, I'd like to correct the atrial fibrillation with cardiac conversions such as amiodarone. And then I'll start anticoagulants. The dose of anticoagulants is 80 ml per kilogram bolus, and then 18 uh, international unit per kg per hour. Then I'll correct the metabolic acidosis.
Okay. How will you transport the patient?
I'll transfer the patients by air ambulance or advanced life trauma ambulance with blue light on, with the CPR equipments and uh, drugs for atrial fibrillations and oxygens and fluid resuscitations.
And syringe pump,
With
amiodarone syringe pump
syringe
লাগবে.
pump with amiodarone.
What is the cause of premature ventricular contraction?
Premature ventricular. I could not remember.
Hypokalemia and metabolic acidosis.
Hypokalemia and metabolic acidosis.
What is the cause of pain?
Cause of abdominal pain or limb pain.
Limb pain.
Due to limb ischemia.
Ischemia to nerve. Okay.
Ischemia to nerve.
What is the early sign of ischemia?
Limb may be pale or pulseless. Pain not responding to painkiller and severe pain during rest.
Right. Okay. What is the uh, এটাকে কি বলে জানি? যাই হোক ওটা দরকার নেই।
Family counseling.
না। আচ্ছা, how to assess the if the limb is viable?
2-point discrimination test.
After transfer, what test will you do? What test you will suggest?
Duplex study.
And anything else?
See, hemoglobin.
For the limb, for the limb. You have already done the duplex, right?
Yes, ma'am.
Is there anything else for any test for the limb?
Angiography, CTP,
Right, CT angiography,
CT
right?
angiography.
Okay. What is the complication you expect after reconstruction of the blood, re-establishment of the blood supply?
Reactionary hemorrhage,
Reactionary hemorrhage, no, it's reperfusion injury.
reperfusion injury.
Okay. Okay. What is reperfusion injury?
Reperfusion injury. I could not remember, ma'am.
It is the paradoxical
Reperfusion
exacerbation of
of
the cellular dysfunction following restoration of blood supply in a previously ischemic tissue. আচ্ছা, আমি আপনাকে
reperfused
দেখে
ischemic tissue. এটা একটা শর্টকাট ডেফিনেশন আওয়াজের বলছে রিপারফিউজড ischemic tissue release which release metabolites
free
from
radicals.
the dead tissue to the circulation,
Hmm. Which causes further deterioration of the cellular dysfunction.
which causes further deterioration of the cellular dysfunction.
আচ্ছা,
Okay.
আহ, ঠিক আছে, এই আর নাই, শেষ। আচ্ছা না, what is the definitive treatment of the limb for the limb?
Angioplasty, then thrombolysis if it is less than 10 hours, and embolectomy or bypass amputation, and avoid reperfusion injury.
How to avoid reperfusion injury?
Amputation
But
Fasciotomy.
fasciotomy.
of